to speak with Dr. Heidi Larson today. She's a professor of anthropology, risk and decision science, and the founding director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. She's been called the world's foremost rumor manager. And as we can imagine, these are busy times for someone with that profile. And I'm very happy that we have this opportunity to chat today. Thank you for joining us, Heidi.
Nice to be here. Go ahead.
Thank you. We have a lot to cover, so I'll jump right in. At the outset, I'm really curious to know, in your expansive career, you've dealt with rumors in all kinds of places, from war zones to Ebola-affected areas. What is so different about the rumors around COVID-19? And, what has your experience been in the last, say, like a year and 3 months?
Thanks. It's been quite a journey, I have to say. We have this background of, and you had mentioned polio. I mean, certainly in the context of polio, we were dealing with and still struggling in some of the hardest to reach areas with rumors, with distrust. And some of that is still there. And then, you have rumors on the other end of things, which is fears of who is manipulating them, what the motive is of all these vaccines. With COVID, it's been amazing, actually, in I think some assumptions in the public health community that this is has been such a bad pandemic from a health impact point of view that this will change people's minds if they were ever hesitant about vaccines. Well, it hasn't really. In fact, the groups and the questioning around vaccines and some of the anti-sentiments have actually escalated in huge numbers. And what were conversations that were very much specific to vaccines are teaming up with other platforms against, particularly around anti-government control, but fears of technology, the 5G anxieties, the anxieties about the vaccine putting a chip in your arm. I mean, these are beyond vaccines. They're about other underlying anxieties. On the other hand, I have to say, since initially there was a bit of a desert when it came to vaccine confidence last year, because I think the focus was more on lockdowns, distancing, masking, because we didn't have a vaccine yet. But since the vaccines have come onto the landscape, there has been a lot of quite creative work going on around vaccine confidence building information. So it's kind of a good news, a bittersweet story in the sense of some fantastic innovation and also some more serious rumor mongering than ever.
Right. And you started the Vaccine Confidence Project in 2010. And since then, you've been looking at data and studying almost 150 countries. So what has been your experience? And you were just alluding to it as well. What is your experience about trust building, and how does that sort of evolved over the years? And what is the specific importance of building that trust within communities right now?
Well, it's crucial, in short, but I think it's been an interesting evolution because I had been working in this area for 10 years before I launched the Vaccine Confidence Project in my role with UNICEF around launching Gavi and the introduction of new vaccines. It's taken the public health community initially from a global level was historically more central down, spread the information out. And, over the years, recognized the importance of locally tailored measures. But now with the advent of social media, we need to be constantly going micro, macro, micro, macro, because on the one hand, the trust relations at a very local level are absolutely crucial. On the other hand, we're in an environment now that you can think you have a reasonably trusting community around vaccines, and they get like disinformation bomb that lands and totally and can turn it around. So we need, on the one hand, our radar out there, on the other hand, trust building at different levels.
Right. And what do you see as the role of social media, both in sort of, spreading some of these rumors, but in also kind of educating people and really trying to get the information out there?
Well, I think discouraging people from, what are we saying now? Think before you share. But it's not always so easy to know if you're not reading up on all these different issues. It's not always easy to know what's true and what's not. And so one of the things is to try to build a more kind of critical eyes on some of what's circulating and build some resilience around it, not just debunk the facts, but kind of get a consciousness that people don't share them as quickly before they know, which isn't easy. And I think what you had asked earlier about what's different about COVID, we are in such a hyper uncertain environment, and the science itself is evolving every day. So I think that makes it a particular challenge because we're working with limited information in an uncertain environment. So trying to build people's confidence when the information keeps changing has been quite a challenge.
Right. And how do you navigate the complex kind of conversations around dealing with vaccine confidence when it comes to communities that have sort of been disadvantaged in so many ways? So in a lot of ways, they sort of feel like they've never been able to trust the government. Where I am in India, rural areas still sort of, are not super confident about vaccines. They don't, government officials have been going in every day. And they set up these vaccine booths, but no one shows up. So, but, you can't really blame them because these are people who have historically felt sort of excluded from the system itself. So how, and I'm sure this is not just specific to India. So how do you deal with, really kind of building confidence within these communities?
Well, I think one of the most important things that we learned certainly in the polio eradication work is that people need to feel like you care about their overall well-being, and you're not just there to push one vaccine all the time. Because we heard a lot, why do you keep coming with that same vaccine? Our children are dying of measles. Look at the dirty water you walk through to get here. We have other needs. We don't trust why you keep pushing that one thing and you're not helping us stay alive more broadly. So I think in the context of COVID, it's really important to try to hear there's so many things that have happened with people. They've lost jobs. They've been separated from families for distancing reasons. There's been a lot of issues. Haven't been able to get health services. So I think it's important in any kind of vaccination outreach that we take that extra time to hear what the concerns and other felt needs are in the community and somehow put the vaccine in the context of that, getting through this together. So it doesn't feel, so there is a sense that, there is caring beyond this vaccine. It can only help. Some people have very deep issues with vaccines and the governments that deliver them, and that may not change their minds. But for many, that will certainly help.
Mm-hmm. Right. So there are disadvantaged groups, and then there are groups such as pregnant women. And, as we know, the vaccines haven't yet been tested as much as they should have on pregnant women. And that has sort of given rise to this sort of skepticism amongst pregnant women. How do you sort of deal with this dual challenge? And what is your message to people who are also kind of at the front lines and, who are hoping to get women enlisted?
Well, I think we have, and we've seen it recently with the news from India, from the high numbers of pregnant women who have really died from COVID. And we had already been seeing that COVID infection it took a disproportionate toll in serious illness and sometimes death with pregnant women who are more vulnerable. In the same way that women who are pregnant are more vulnerable to more serious consequences from flu, which is why flu vaccines are recommended for pregnant women. So I think we need to put the vaccination in the context of the alternative, which is quite serious. And certainly in this current India context, hugely vulnerable to COVID infection. So there has actually been quite a bit of observational work around vaccines given during pregnancy with the COVID vaccine. And it's, so far it's all seemed to be safe and effective and really important.
Mm-hmm. Right, that's really good to know. And then we don't have much time, but I'm hoping to, add in one more question. So, you've been speaking with governments at, sort of like a wide range of, socioeconomic backgrounds from India to Rwanda to Colombia. What is your message to these governments as they are hoping to sort of tackle this issue of vaccine hesitancy going forward? Is there a secret sauce, or does it have to be tailored, according to context?
Well, every sauce is different in each of these countries, so to speak, and even at a local level. So I think the important thing is to really understand what the issues are. I used to have a sign on my desk at UNICEF saying, "You can't fix a problem you don't understand," or "Communication can't fix a problem you don't understand." So I think it's really important to listen and understand what the issues are, because in some settings, it might be very specific to a safety concern. In another, it's a bad experience with the local healthcare center. In another, they're worried that the vaccines don't work. So I think there's a whole mix of trust reasons, very specific reasons. And, in some cases, we had experience that people didn't want to get vaccinated by a man. They wanted to get vaccinated by a woman or someone local, that if there was a problem, they could find them, to follow up. So I think it's just really important to understand these dynamics and what's really driving the issues.
Right. And as you say, sort of, communication is key, localization is key. Is there one thing that you are looking forward to as, we sort of go into this next stage of the pandemic?
Well, I think I think there's been a lot of learning, a lot of opportunity here. I mean, in the history of vaccines, I don't know when publics have had so much exposure to how vaccines are made, to what it takes to make, discover them, the regulatory reasons. It's been in the news every day, all kinds of things about vaccines, which I think it's been a huge opportunity from an awareness point of view, and people way beyond the health system. This is not a health problem. This is a global problem at challenge at many levels right now. So we've had a huge opportunity for awareness. And I think that people will remember COVID in a big way. And I think it's a really critical opportunity for us in terms of vaccine confidence moving forward. If people feel like they were heard, they were treated well, and they could build a bit of trust in a time of crisis, really, that will stay with them. They'll remember that when you come around with the measles vaccine or whatever vaccine or other health intervention moving forward. So I think it's a real opportunity. If they don't feel well treated, if they feel dismissed or judged or excluded, that will be the thing they remember. So every day in the context of COVID, we have to be conscious that what we do now will be remembered.
Right. That's a great message. Thank you so much, Heidi. This has been such an honor speaking to you.
Thanks.
Thank you.